Welcome, everyone. Thank you for joining us today. If you need closed captioning, you can click on the CC button located at the bottom of your Zoom screen. You may need to click on the More menu option to access that closed captioning button. My name is Lauren Whittick, and I am the Communication and Assessment Specialist for Region 4, which is based out of the University of Utah Spencer S. Eccles Health Sciences Library. Region 4 is comprised of 9 states, which are Arizona, Idaho, Colorado, Montana, New Mexico, the Dakotas, Utah, and Wyoming. So since some of you may be first-time attendees at an NNLM webinar, I just wanted to provide a very brief overview of what our organization does. NNLM stands for the Network of the National Library of Medicine, which is part of the National Library of Medicine, which falls under the umbrella of the National Institutes of Health. So NNLM has 7 regions, you can see here on the map on the slide, and that covers territories in all 50 states. Our guiding mission is to provide equal access to biomedical information and improve individuals' access to information to enable them to make informed decisions about their health. Regionally, we collaborate with various organizations, including but not limited to public and academic libraries, schools, hospitals, and community-based organizations. Our efforts are primarily conducted through 3 main methods, which are providing funding to enable organizations to support their communities, conducting outreach, and training like today's webinar. A few housekeeping items before we get started. By registering for this session, you have agreed to the NNLM Code of Conduct. Please keep your questions and comments respectful, and this just allows us to create a welcoming learning environment for all. We are recording today's session, and the slides will be made available. Please note that editing and captioning the video can take us just a couple weeks, so just please be patient. However, we will send the link to the recording and the slides to everyone who registered once they're available. We're also going to share a link to the evaluation toward the end of the session. We would love to hear your feedback. It's also how you can earn continuing education credit through MLA, should you be interested in doing so. And finally, we ask that you enter your questions into the chat as you think of them. We'll have time for Q&A at the end of the presentation. Moving on, our next Region 4 webinar will be held in March of this year. We'll make an announcement on our blog and our webpage when we have all the details sorted out. If you'd like to stay up to date with Region 4, we encourage you to sign up for our newsletter or check out our blog. The QR code here on this slide will take you to our regional page, which is nnlm.gov/about/regions/region 4. If you live outside of Region 4, I encourage you to head to nnlm.gov to find and connect with your respective region for additional training, funding, and outreach opportunities in your area. Now I want to welcome today's wonderful guest speakers, Dr. Laura Hosman and Dr. Heather Ross. Dr. Hosman is co-founder and co-director of SolarSPELL, an offline solar-powered digital library and information literacy building initiative designed for low-resource locations globally, housed at Arizona State University. The SolarSPELL, which stands for Solar Powered Educational Learning Library, initiative combines localized educational open access digital content, easy-to-use portable rugged solar power technology, partnered capacity building, and impact evaluation. Hosman is also associate professor at Arizona State University, holding a joint appointment in the School for the Future of Innovation and Society and in the Polytechnic School. Her action-oriented work focuses on the social impacts of new technology in developing countries, particularly in education, lifelong learning, and information literacy. Dr. Heather M. Ross is an assistant professor in the Edson College of Nursing and Health Innovation Center for Health Promotion and Disease Prevention at Arizona State University. Her teaching and research centers on health equity and policy. She leads research in dementia and homelessness, crisis mental health response, digital health equity, and directs the SolarSPELL Health Global Library Initiative. Dr. Ross maintains clinical practice as a nurse practitioner in cardiac electrophysiology and serves in leadership roles in multiple civic and professional state, national, and international organizations. And with that, I'm going to turn it over to our wonderful guest speakers.
All right. Have I done everything in the right order so you're seeing the presentation as you should be? Great.
Yeah.
Lauren, thank you for the invitation to come and speak. We're really delighted um, to be here with you all today and looking forward to not just this presentation, but certainly to the Q&A afterwards. And so, as Lauren said, the SolarSPELL initiative at ASU empowers learners globally with both offline digital libraries and the skills that people need to thrive in the digital age. I have slides introducing both myself and Dr. Ross, but I feel like you have just given us such a lovely introduction. I can skip through those really quickly and talk about our reason for being at SolarSPELL is because we believe that access to information is indeed a human right. And yet, fully half the world's population still can't meaningfully use the internet. Meaningfully being the key word there because they may not have coverage, but probably more importantly, these days, they may not be able to afford internet use. They may not speak a language that they can find content in or services in, etc. And so it's that word meaningful that makes all the difference in the world as to whether people can find the internet empowering or not. Thus, many people out there are working to connect the other half of the world's population, and we say, not just so quickly, please. We don't believe that connecting this half the world's population overnight actually is the answer. Why on earth would I say that? Well, it turns out that this for-profit internet that currently exists can be a very dangerous place, particularly for inexperienced users. We could also put into that category children. And so we believe that those who are the least experienced are most at risk for disinformation, misinformation, scams, cyberbullying, sexualization. Unfortunately, the list goes on. So this is indeed exactly why we challenged ourselves to come up with an answer to both of these challenges, basically. So how do we get empowering educational information to offline communities globally while simultaneously helping them build what we call internet-ready skills, information literacy and digital literacy. Thus, forming the Solar Powered Educational Learning Library or SolarSPELL initiative at ASU. As a library, we take an ecosystem approach, always and always starting with content, making sure that the content on our libraries is curated with and for our library users so they can really see themselves in the content. We continue with some pretty cool offline solar powered, portable, rugged, easy to use technology. I'll come back to each of these categories. A train the trainer approach, meaning that skills not only cascade but then continue to grow locally. And then conducting impact evaluation to know that we're having the best impact possible or where is there room for improvement. So my next slide has these same four concepts but allows me to show that we are indeed learning from our impact evaluation in all areas and that our library users and partners are truly at the center, at the heart of all that we do. So now let's take a closer look at what our libraries look like. So here you're seeing a homepage of an education library that's being used currently in Lesotho. We call it our Southern Africa Educational Library because we regionalize these libraries and then further localize them for the specific country and sector where they're going to be used. Here you're seeing, if you can actually make out what the tiles say, all of the topic areas that you might expect to see in a K through 12 setting. Sector-wise, we were able to expand during the pandemic, not able to travel. We were finally able to put heads down and focus on creating entire collections that our library users were requesting. So in terms of health and agriculture, you'll see that one next. Our health library here, curated not just with our own students in the Arizona State University, but working with the faculty and librarians at our partner institution in Malawi, who you're seeing here. And then our conservation agriculture library, also covering all kinds of topics that might be relevant to a farmer or an agronomist in Rwanda or South Sudan, for example. And then we also have education libraries that are not in English. So this is our Middle East education library currently being used in Northeast Syria that is entirely in Arabic and Kurdish. Okay, So now you've seen what some of the libraries look like. We're going to, and the content, everything on the libraries, no matter where they're going, is open access. And the idea is just to get people access to the right content at the right time that our partners and library users are asking for. How it works is that, so this is what the library looks like. I'm holding one up in the video, but or sorry, in the camera. Video of me, I guess you could say, over Zoom, but I'm going to show a really quick video here, animation of how it works technologically speaking. So inside of that library, there is a microcomputer called a Raspberry Pi that we have told to believe it's a server. It is serving up an offline Wi-Fi hotspot that any Wi-Fi capable device can connect to. You look for a SPELL Wi-Fi signal, type in 10.10.10.10 to your favorite web browser. That's it, you're connected to the tens of thousands of PDF files, MP4 videos, MP3 audios. And if you like what you see, you're welcome to download it and take it with you. And actually no need ever to return it. So, SolarSPELL is the world's only solar integrated offline digital library. About 25 users can connect at a time. And this rugged, user-centered, solar-powered design, made out of 90% recycled plastic, by the way, means that we can really reach anyone, anywhere. We have been on a roll lately, so this has been a year of awards for us. In March of last year, we were named Best in Show at the South by Southwest Innovation Awards. Time named us to their Best Inventions list this past year. We also took the top prize at the QS Reimagine Education conference, as well as at our very own university. Our president named us, gave his award for principled innovation. But we're actually not new to this. So I'm going to come back to this slide in a minute, but this is having to do with our training. So I'm going to draw your attention to Mrs. Labo, or May Labo from Lesotho, over on the right-hand side of this slide, who was such a champion in what she was doing to introduce the library to her school that we invited her back to share all of her secrets of her success with the next round of trainees. And so that is part and parcel of what we do, sharing success stories with everyone using the library, and having those skills cascade not just from us, from Arizona, but from the people who are really in real time using the libraries and introducing them to their communities and their schools, etc. So since 2015, we've been around for 15 years. We have reached more than 496,000 learners around the world, with 92% of them telling us they feel better prepared to do their job, 88% of them reporting improved digital literacy skills. This impact truly holds across sectors. I'm going to run through a couple of the testimonials on the next slides. Here you're seeing the numbers across the sectors. In the schools, we hear that the library inspires creativity, motivates teachers and students, test scores improve, English reading and speaking capabilities improve. From Northeast Syria, students' ability to search for information, it's got enhanced their confidence in self-guided research. From a refugee camp in Ethiopia, children are learning on their own, they're playing and they're learning. From Fiji, low exam scores went up to 100% pass rate. From South Sudan, schools become one of the best in the region, and class attendance improved. So this is all well and good, Laura, but in fact, I can almost hear you saying, we came to hear about the health library. So now this is my opportunity to turn it over to Dr. Ross, and she's going to tell you about the SolarSPELL Health Library, really basically from its origin.
Yes, thank you so much, Laura. So Laura mentioned that our health library got started during the pandemic. Its origin was a little bit before that, a few years before that, when Laura had just recently come to Arizona State University, and we were chatting about the primary and secondary education libraries, which were mainly in service in the Pacific region at that time. And I said, it seems like there is a use case for health education with the Solar Spell Library and the Solar Spell Initiative. And she said, I'm so glad you asked. Literally yesterday, the Peace Corps in Vanuatu emailed me and asked if we could bring additional libraries for their health volunteers. And we've never done that before. So there was the genesis of the Solar Spell Health Library. That was in 2017, and we were very fortunate to be able to have some nursing students, advanced practice nursing students, travel with the Solar Spell team to Vanuatu to just get a better understanding of what some of the health education needs were there. And we began to curate and create some locally relevant content that was disseminated in Vanuatu. As one very brief example, one of my former doctoral students created a short whiteboard video about blood pressure management, managing hypertension, and disseminated it in a very extremely rural region where there wasn't access to medications to treat hypertension. She went in, took blood pressures. They were high, unsurprisingly, very high. She then shared this short video that she had made in the local language that talked about maybe managing salt, maybe smoking fewer cigarettes because those are available everywhere. It doesn't matter how rural it is. And things like this. Came back a few weeks later and remeasured people's blood pressures. She showed a 9-point systolic drop, which translates to 40% stroke risk reduction. That is the power of information and education to really markedly change people's lives. So in 2019, I had the opportunity to travel with Laura to South Sudan for an education project. And while we were there, we met with, and you can see us here meeting with the Dean of the College of Medicine at the University of Juba. We showed him and his vice dean, who's looking over the shoulder, the Solar Spell Library. And at that time, it was really the primary and secondary education library. We had a health encyclopedia, a little bit of community health information, but that was about it. He said to us, this will be a game changer, and then shared with us the 3 shelves that you're seeing on the right. That is the medical library for the University of Juba. You can see that there are some textbooks. You may or may not be able to tell how outdated the textbooks are, but that was the entirety of their brick and mortar medical library, which is shocking. That was for a country. Now, they did have a computer terminal that funded by the United States State Department. I don't know if it's still there, to tell you the truth, but they did have internet access, which could get them access to the National Library of Medicine for some additional research. But that was about it. And it's really important to know that internet usage is extremely constrained in places like South Sudan. Sure, there's a cell signal, but there's no such thing as an unlimited data plan. And very few places have meaningful Wi-Fi. So the idea of logging in to watch streamed lectures from an American university is anathema. So that with that interest, we said, all right, well, we must create a health library. So would you like to move forward? Wonderful. Thank you. So we then visited the Juba School of Nursing and Midwifery. This is what a typical private nursing school looks like in South Sudan and frankly across a lot of sub-Saharan Africa. We went in unannounced with our guide from Juba, and we were met by what we thought was a skeptical administrator who left the room and said, I'll be right back. Turns out was an instructor who returned with her 60 students, who every one of them had a smartphone. The reason that they had a smartphone is they were required to in order to go and collect data out in the community for their research course. Did they have access to the internet? No, they did not. We fired up our libraries. What you're seeing in this image is an older version of the library that looked a little bit more like a science project than our current library looks like. We fired up our libraries, taught them how to connect. It took about 1 minute, and they immediately found their way to the medical encyclopedia and were strategizing with one another about what to download so that they could get as much information collectively as possible. Um, that was when we knew that there was not only a need, but that need had legs, and we could see the vision, the future of how successful a health library could be in sub-Saharan Africa. It's really important to know, and Laura, I didn't know if you wanted me to talk about this or if you wanted to take it, but Laura mentioned earlier that every bit of content in every one of our libraries is localized for the communities it's going to serve. And one of the things that we know about health education is, yes, there is indeed some localization, but a lot of the magic of health education is that I don't care where you are in the world, the foot bone connects to the ankle bone, right? So that means that a lot of the content that we curate for our health library is deployable anywhere we go. Language is the big variable. So in any of the Anglophone countries or the countries where English may be the language of instruction for healthcare students and health provider students, our health library content, much of it is evergreen across communities. Not evergreen in terms of time. We have, for our health library in particular, instituted a regular schedule of review and update for every item in the library to make sure that we are presenting the best, most current evidence-based content. Now, when we talk about best, most current, that's where the localized bit comes in. It's one thing to say in the United States that the best, most current evidence says that someone experiencing symptoms of a stroke should get in a scanner within the first, 90 minutes. Well, there aren't scanners in the places that our libraries serve generally. So we do localize the content to be relevant to the places that we're rolling it out. This is an example of the kind of video content that we are able to include in our health library, which has more than 19,000 items in it now, including textbooks, MP3, other MP3 documents, videos like this that would never, ever, ever have been available streaming to healthcare students and general users, even those who are serving or learning in regions where there is cellular coverage, which is a lot of the world. But we've heard over and over from healthcare learners, from student nurses, and from clinicians across across sub-Saharan Africa that we've heard from students that they have to make the choice often with their internet connectivity. They can choose whether to buy data or buy food. That's the choice. And so with our libraries, we can make sure that they eat while they have access to more data and more resources than they could ever afford economically. One other point about creating content is we have been able to leverage the wealth of content generation here at ASU. And one of the things that we've built into the library is a whole education module on evidence-based practice that includes videos and activities and all sorts of things like this. One of our former Doctor of Nursing practice students built out this section, and it's meant to be a teaching resource for healthcare instructors around the world. Here's an image of our training at the Kamuzu University of Health Sciences in their library. This is one of the national health universities in Malawi. We had such a wonderful opportunity there because we worked very closely with their librarians because we love librarians most of all. And we expected that our libraries were going to go into service on the campus to provide additional resources for students on the campus. We very quickly learned, and they brought this to us, that where they actually needed the libraries was out in the field. Nursing education works a little bit different across most of sub-Saharan Africa, including in Malawi, in so much as that students spend the first part of every semester on the campus in the classroom doing didactic education. And then they go out often to a very different part of the country, into often a rural or remote region. And they live there for anywhere from 6 to 14 weeks while they're doing their clinical training or their clinical detachments. When they are there, students from this university would historically visit the library, and a student leader of a group of maybe 10 students would check out an armload of textbooks, trying to anticipate what kinds of information they would need when they go out to a remote village to learn in a clinic, and they would hope for the best. Well, they were able now to check out a SolarSPELL library from their university library and take it out to the clinic to support their clinical learning. We, of course, conducted training, train the trainer workshops here, and around this table were administrators and educators and, really critically importantly, students. Having all of those people literally at the tables. We did 2 different trainings, one in the north and one in the south in the country. Having all of those people at the table, that was what made the magic happen in Malawi. And those are the people who said, aha, this is actually the use case, taking it out with us to our clinical detachments. So we conducted site visits out in the clinical setting. We are at a rural hospital in Malawi, a couple of hours outside of Lilongwe here, with their clinical instructor is the gentleman in the white coat. And then you can see some nursing students. They still wear white caps, which is pretty great. And we conducted written surveys. That's how we got a lot of feedback and information from them. And so we site visit, survey, and we also conducted a skills assessment exercise. We wanted to make sure that what they were telling us in the surveys, they could demonstrate for us. And then we conducted one-on-one interviews with some students. We got amazing information back from the interviews. We heard stories of affordability and cost. Agatha, who's a second-year student nurse, told us we never had access to books at the rural hospitals, so we were just using Google. We were buying our own data bundles, and now we can download books and videos for free. We heard from Martha that she needed to perform a urinary catheterization, and she had never done it before. And she was out in the rural hospital, and she said after watching and downloading the videos on the procedure, I then got to my real patient and I was able to do it effectively and safely. That's really important. We also then heard from Dr. Noel, who's one of the lecturers, and he told us that he saw a great change in his students. They were able to say, I got this information from such and such reference. He said that's already evidence-based information. So definitely the SolarSPELL library is enabling them to implement evidence-based practice using the information there in the library. We also heard from Anis, who is a second-year nursing student. She told us the nursing care we provide to patients is different now. It's being updated by using the SolarSPELL. For example, we have videos on how to provide the care in practice, and because of that, we are able to manage the conditions. We can make patient care plans. We're able to get the information and then practice it on the ground. A couple of other things that I'll note, and here's just a lovely photo that they sent to us of their student nurses who are so excited about the SolarSPELL library. A couple of additional points we heard from student nurses that they were using library resources to help educate patients about how to care for their chronic conditions. So exciting. The other thing we heard is that people would use Google. They didn't have data to surf around, so they would click on the first link, the first hit, and they didn't even know that that was an ad most of the time. So we really saw that we're able to massively step up the quality of evidence-based information that we're able to provide to these learners. And yes, 100% reported that they were better equipped to do their job of being a nurse by using the SolarSPELL library. We also launched a SolarSPELL library initiative, another health initiative here in the state of Arizona with our partners in the Hopi tribe, the Hopi Cancer Support Services. We're so excited about that partnership, which is bringing cancer-related information to the community navigators and health educators for the Hopi tribe. And we also have started a crisis response health inflected library in partnership with the Phoenix Fire Department's Community Assistance Program, and their crisis and behavioral health responders have SolarSPELL libraries on their rig to provide digital content, videos, education in a few different use cases for those people that they're responding to in the community. And here we come back to Maylabo. With all of our implementation partners, I will put just a note in that our healthcare students here at Arizona State University, our Doctor of Nursing practice students and our PhD students, and some of our undergraduate and master's students are also getting this hands-on opportunity to do real world implementation work and understand those critical aspects of health information literacy out in the community. And really, it just changes how they see the world. And I feel really passionate about that as well.
Heather, if you don't mind, would you be willing to say a little bit more about this project? Because I just think it's so unique in terms of what we've been describing so far, and I think we're going to get questions about it too. People have been really, really interested in this project, and I think it could have relevance even across all of the states, Region 4. So if
Sure. Yep, absolutely. So we are blessed to have in the city of Phoenix a really robust crisis response program. These are first respond, well, they're kind of second responders, or they're first and a half responders. So these folks, and you can see them, their backs wearing green shirts, they roll into a situation where community members have experienced some kind of crisis, think house fire, attempted or completed suicide, attempted or completed homicide, domestic violence, it's somebody's worst day of their life. These folks roll in and their job is to be there on scene and provide that link from the trauma response with firefighters and police officers and help people make those connections to what happens next, whether it is to the Red Cross or to a funeral home or to counseling or what have you. We came to know this group within the city of Phoenix when I was doing some work with the mayor's office a few years ago. And I had the opportunity to do a ride along on their rig with them, a few ride alongs. One of the things that they have on their rig is a library collection of pamphlets and handouts. And it's like a hanging file folder. And depending on the needs of the victims in the field, these responders would go through their file folder and pull out the Xeroxed handouts that they need and put them into a manila envelope that they write the case number on the outside so that people can follow up and get their records and whatever they need from the city. And then, hand them the envelope. They would go through the information with them. They're not monsters, they're wonderful. They would go through the information with people. But then, the crisis responders leave and people are left with this information. So when I was out in the field with them, I observed a couple of things. I observed that I was at one house fire and they handed all of this wonderful information in a manila envelope to this woman who had literally lost everything. And she only had her handbag with her and was trying to navigate immediately where to shelter her family that night. And her grandbaby, who was 4 months old and had had smoke inhalation with his 16-year-old mother. And, they were off at the emergency room and all of these things. And I thought, where is this lady going to keep this envelope full of materials? It's very likely to get lost in this unbelievable shuffle that this woman needs to manage. I was at another call where I was observing the new widow of a gentleman who had died quite suddenly. As I was watching her navigate the information that the responders were sharing with her and were going through her, I got the sense that she might not have a high level of literacy. And so I realized that we had a lot to do. And I did see somebody, I saw the word literacy pop through in the chat a few minutes ago. And I realized we had an opportunity to help the fire department and the community assistance program do even better by helping them to create low literacy, which equals, sometimes equals high color, high image-based content in ways that they might not be able to manage with a black and white printer. Also incorporating video education and things that they can't do now. And I also am aware that a lot of people in the community, even here in the city of Phoenix, don't have that unlimited data plan, don't have robust access to the internet. They may be on the street, they may be close to experiencing homelessness, they may have very spotty access to Wi-Fi services for downloading, streaming, or streaming video or downloading videos or what have you. And so we have been working very, very closely to not only digitize all of the paper products that the crisis responders use, but to translate those to low literacy versions and to build out their video content. They also brought to us another use case, which is that when they have children on a scene, oftentimes if there's a police investigation, they will need to keep children on a scene, young children. They have a kind of roomy van that they can do that in, but for hours and hours, often they were finding that they were given kiddos their own personal cell phones to stream YouTube videos. And we thought, you know what, we can do better. So we have been developing video content that is age appropriate for little ones and does talk about some of the sort of scary feelings and things like this, in addition to providing distraction, because what the evidence tells us is that the most protective thing that you can do for a child in a trauma experience is provide distraction during that immediate trauma experience. So we've been building out video content that we know is going to be safe, because if you put a kid on the internet on YouTube, they're going to be someplace they shouldn't be in a matter of moments. So by having it on our SolarSPELL library, we're offline. We're not connected to the internet, and we know the kiddos are going to be safe.
Thank you so much. Okay. So talking about Phoenix Fire, I felt just went to show how different our partners are, but truly how we're listening to our partners in terms of what content needs to be on the library, and hearing their use cases, needs of what information they need really makes for very different collections based on all of the above. And then Heather was also sharing how much her doctoral nursing students are doing to curate this content. And it is a years long process to even get to version 1 of our first libraries when we're starting from scratch. We are also continually improving them. So not just making sure that all of the content is up to date, but forever looking for more and better content and responding to our partners' requests for information. And it is indeed the 200 plus university students who we engage every year who are the secret sauce, if you will. The majority of students who do work with us are Arizona State University students. They may be located around the world. We have a number of online students as well as in-person students, but we also engage students around the globe when we have the need for such expertise. And so we have students from across the United States and around the world, indeed. So a team of 8, but that allows us to oversee a really large number of students who generally join us as interns. Some of them join us for classes. But the point is, many hands on deck with all different areas of expertise are what allow us to have such a global reach. And so since 2015, we have implemented about 700 SolarSPELL libraries across 15 countries around the world. And as you can see here, even and including right here in Arizona. If you were in the same room with us, this is how you would be connecting to the library. I would say, please take out your smartphone. You'll look for a Wi-Fi signal called SPELL. Once you're connected to it, you'd open your favorite web browser, type in the numbers 10.10.10.10 into an address bar, go, and then start exploring. And so this, again, is how you would connect if you were in the same room with us. If time allows and there's interest, we could also give a tour of the nursing library or the health library for you today. But to sum all of this up, we believe that libraries really do have transformational power. And so improving education, improving agriculture, saving lives with all of our collections, all of these skills are underpinned by the unmissable skills of digital and information literacy. And that's our presentation. So at this point, we would really truly welcome as many questions as you'd like to give us. And if you would like to know more, of course, we do have a website, and we invite you to follow us or keep in touch with us on all of those platforms. So I can end the show.
So I can take some of the questions.
Do,
Any
do,
plans to expand the library to other continents or low income or low internet access areas or beyond Region 4? Yes, there is a 16th country that is going to be added to the map in West Africa as of 2 months from now, which is very exciting. And we've got an additional project. Laura, did you want to mention? It's not the health library, but additional work here in Region 4.
Yes, with the Tohono O'odham tribe for education libraries, hopefully getting started early this year. So, absolutely.
Yep. Do we work with Street Medicine Phoenix? No, we don't, but I do know Street Medicine Phoenix very well. A lot of my research has to do with homelessness, and we're just figuring out the use case with that population as well. I will note that there is quite a lot of crossover between that population and the crisis response population that we work with here in Phoenix. Um, Copyright issues, every item in our library is open access, or if it is copyrighted, we have explicit permission to use it in our library. And do we maintain archival versions of material? I think our librarian would seek to do us physical harm if we did not.
Thank you. I have a question. Oh, we got an audience question. So go ahead.
Oh, yes, about could there be collaboration with FEMA? I think that would be a really brilliant use case. And we've not had collaboration with FEMA, but we most certainly would welcome those kinds of communications and those kinds of conversations. Yes.
So my question is, you mentioned regularly assessing your project to find areas of improvement. Can you share the types of, some types of feedback that you've received?
Sure. I can from our actually from our crisis response. So one of the things that we have come to understand, and this is a nut that I am actively like this keeps me awake at night, like as recently as yesterday. Um, when for many of the types of crises that our crisis response partners respond to, the victims, the family members, are not comfortable turning off their phones or disconnecting their phones from the internet or from cellular service because they are taking incoming calls. And I'll give you an example of when this happened. And I saw this happen as soon as I heard it from a crisis responder. I recalled a crisis that I was responded to on a ride along. Unfortunately, a 12-year-old girl completed suicide, and her adult family members, her uncle and both of her parents, were there in the home and getting constant incoming phone calls and text messages from loved ones. And when a crisis responder said to me, our customers, that's the terminology they use, our customers just aren't comfortable turning off their phones. They have family members and loved ones calling them. I went, oh my gosh, it didn't even occur to me. So that's exactly why we do our in-field follow-up. And I'm trying to now think through, okay, um, how can we navigate this? But that's, I think, that's a real life today example of the kind of feedback and the way that it's making us um, not reconsider, but additionally consider the how we're doing the work that we do in the field. Laura, do you have other? examples to share?
I guess it was just really also eye-opening. You've already shared this earlier, but when we went to Malawi and had our trainings with all of the health professionals, librarians, instructors, and students, and before this, we had had countless meetings over Zoom, but had not somehow come to the conclusion that it was the rural areas that needed the libraries because we hadn't heard that yet from our partner because they hadn't been able to conceptualize that. So in all of the planning, we had been planning to bring these libraries to the capital city and the other largest city, the two that you saw in the slides, Blantyre and Lilongwe, and leave them in the libraries there and maybe bring them out to the classrooms on campus. But they already have pretty well resourced libraries, internet connectivity, maybe not to all of the classrooms, but truly after they saw the libraries and started using them in this training, they said, you know where we really should be using these. And so then coming up on the spot with the system of, oh, you can check out a library from the library and bring it with you. And then we had to come up with how are we, best going to assess this impact, etc. So
Yeah, that's a perfect example. I will also share, and this should go without saying, but I'm going to say it anyway. We do work very closely with our partners they guide us in terms of content curation. And that leads into George's question too about information for cultural reasons may work in one place and not another. Absolutely, 100%. And that is top of mind for us. I will give you some examples. Content related to gender equity and particularly to the LGBTQIA plus community. That does not fly in every country. And that can indeed pose a barrier in many countries. Some of the countries that we work in, homosexuality is illegal, which is hard for me personally to stomach, but that is the case in that country. And so we are mindful of that. I will say that gender equity is a cross-cutting theme across every one of our libraries. So we certainly, in terms of cisgender equity, that remains always, but we are mindful that we don't want folks to get in trouble because of the content in our library. Another example, we get requests for more content related to mental health and suicidality. Everywhere we have worked in the world, we are always getting this content. We know that behavioral health content is really intertwined with culture like this. And so we are very mindful of making sure that any behavioral health content that we include, behavioral health in particular, we're very mindful of culture and cultural appropriateness. And so that is always, it is the first request. And it's the one that we grapple with the hardest because that is one that we can't get it wrong. Because if we get that wrong, we risk having the libraries excluded from a community. And we don't want to do that. So I hope that answers your
and
question,
if I can
George.
add two more things
Yeah.
to that very quickly, are all of our interns undergo um,
Mm.
training in cross-cultural, you know, awareness, appropriateness, understanding before they ever start curating content. That is part and parcel of our internship program. And
Mhm.
then the second way is to have a constant dialogue with our partners. And so,
Yes.
especially when a flag goes up in our mind or a question, we're always sharing all of the content of our libraries with our partners. But if there's some stuff that did get flagged, then that's the stuff that we certainly bring to their attention first and foremost and say, all right, we need to ask your opinion on this.
Mhm. And that is indeed how we vet for cultural appropriateness. I'll add to that with our tribal partners. For example, our Hopi tribe partner is quite private. And we have built a trusting relationship with them where the Hopi specific content is only available on the libraries that they have. The Hopi specific content does not go on to any of our other library collections because they know that and they know that they can trust us to maintain the privacy that they wish to maintain for their local cultural content. We have been able to build a really, really productive relationship with them. It's a little bit of a different take on that cultural appropriateness question, but I think it's significant. And then what relationship do we have with IHS? We're actually just starting to build a relationship with IHS. Our relationship began with the Hopi Cancer Support Services and the Hopi Women's Health Program, which is distinct from IHS. I'm so delighted that IHS has reached out to ASU for some clinical training support. It makes my heart so, so happy. And they are really keen to, and Laura and I haven't even talked about this yet, they are really keen to engage SolarSPELL Health libraries in their clinical training and clinical conduct, your clinical activities at IHS with the Hopi tribe.
I have one more question in case some folks are still ruminating. I have a logistical question. How do they get their handheld device repaired if there's an issue, or what happens with that?
So when you say their handheld device, you mean the library?
The library, yeah.
Yes. So we work very hard to make sure that these are as rugged as they possibly can. There are no moving parts inside. We triple test them before they go out to the field. Having said that, we always leave at least 2 spare libraries with our partners. And so that also means that we do have a centralized partner that we work with, not just for that reason, but also for getting the updates. So updates happen over the same offline Wi-Fi hotspot that one connects to navigate the library itself. And then our partner, trusted partner, would be the one connecting to the library to make the updates as well. But that just speaks to why we need to have one centralized partner. Also for training, they're helping us organize a train the trainer training. They're also helping us either organize or conduct impact evaluation. So our partners play a very valuable role. You also heard me from the beginning talking about how important they are in terms of the content on the libraries. So.
And
Thank
the
you.
libraries, you can't tell from looking at it, the whole outside black rim, that's a rubber gasket. It's designed to be rugged. Think like a toddler could play with it and it would still work.
Durable, very durable.
Yeah.
Well, seeing no other questions, I think we can wrap up. I will say, if folks in the audience, if you think of any questions, you are welcome to email. I'm going to put this in the chat. region4@nnlm.gov, and we can pass your questions along to Laura and Heather. So feel free, if you are watching this recording later on and you think of a question, please email us and we can pass it on. We'd be happy to. Thank you so much. This was so wonderful. I loved hearing about your work.
And if I may, if anyone who's watching this has recommendations for other connections and of course, funded opportunities to implement our libraries, we would be very, very excited to have those conversations.
All right. Thank you, everyone. Have a fabulous day.
Thank you.
Bye now.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.